Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Assessment of the severity, and this is of the acute pancreatitis. So first we begin with the BSAP. So what is BSAP? Here BSAP, it stands for the bedside index. It is the bedside index, and this is for the severity of the acute pancreatitis. For the severity of the acute pancreatitis. So what does it include? It includes the BUN. BUN means the blood urea nitrogen. It is greater than the 25 milligram per TL. Next, it also includes the impaired mental status. There is presence of the impaired mental status. So impaired mental status as well as a Glasgow coma scale. There is a Glasgow coma scale. So this is nothing but the GCS being less than 15. Next what we have is the SIRS. So what is this SIRS? SIRS, it stands for the systemic inflammatory response syndrome. It is a systemic inflammatory response syndrome. And then when you look at age is greater than 60 years. Then the 1 point is given for each. So 1 point. So 1 point is given for each. And the BSAP score greater than 3 indicates a severe pancreatitis. So in terms of BSAP score greater than 3, what it indicates is the pancreatitis, that is severe pancreatitis. Now let's look at HAPS, HAPS. So in terms of HAPS, what is the full form of HAPS? HAPS here stands for the harmless acute pancreatitis score. So it is a harmless acute pancreatitis score. So how is the harmless acute pancreatitis score? That is, if all the following are present, then it is considered as a non-severe. That is, there is no death, no need of dialysis, or no need of ventilation. And there is absence of rebound tenderness or guarding. There is absence of the rebound tenderness or guarding. Next is there is a normal hematocrit. And there is a normal serum creatinine. Normal serum creat. Next we move on to the Apache 2. So what is meant by the Apache 2? So Apache 2, it stands for the acute physiological and chronic health evaluation. So it is a acute physiological as well as the chronic health evaluation, as well as the chronic health evaluation. And this is known as the Apache 2. And here a score of 8 or more, so greater than 8, it is considered to be severe. Next is it can be done at admission and repeated at any time. So it is done during admission and can be repeated anytime. So it is repeated anytime. Next is a complex not specific for AP. Next we have the complex, and it is not specific for AP. Not specific for the AP, and this is based on the patient's age. This is based on the patient's age. Next, what do we have in line? There is also the Ranson score. Ranson score, then there is also the modified Glasgow scale. So modified Glasgow criteria, and modified Glasgow criteria is 3 or more positive criteria. It is greater than 3 or more positive criteria, and the disease is considered to be severe, and disease is considered to be severe. So there is also the Atlanta classification. So there is also the Atlanta classification. To learn and grow daily like this, please do subscribe.